So thanks a lot to everyone. So please take your seats. We're going to start in 1 minute. I just wanted in front to say that there was some presentation that will be in French. So please, there are headphones distributed. So if you are English or French, and if you are not bilingual, please take headphones. Thanks a lot. Merci beaucoup à tous. Et donc, on va commencer. We're going to start. So first of all, thanks to all for attending this important symposium. And thanks to the organizing committee, so Bruno Smil, Annabelle de Grelolou, Daniel Rojas Castro, Didier Couvi, plus ANRS colleagues for organizing this session. For those who don't know ANRS, ANRS is a French national agency which is a funding, and we really want to emphasize on that we are not only a funding but also a coordinating agency, evaluating and facilitating research on HIV and hepatitis, but also TB and now emerging infectious diseases and STDs. ANRS is engaged in research program in France, but also abroad, with a large number of partners in low and middle income countries in sub-Saharan Africa, in Asia, and in Latin America, thanks to the efforts that have been done by previous ANRS directors, one of whom is here present, Michel Kazachkin. Thanks for attending. ANRS has a long experience working with civil society, with community, with NGOs. They participate effectively to all the scientific bodies, and they contribute to the evaluation of research projects. From the beginning, they are involved in research projects. At the beginning of the 2000s, ANRS has started to fund research projects jointly developed by research community, but also by the community that are researchers, actually. We are very encouraged by our experience for funding community-based research programs, and we have decided to share this experience at this EIS meeting. We think that we have enormous tools in HIV now, and we should work on implementation science, and implementation science without the community is not possible. So the importance of the community. So I really want to emphasize the importance of community-based research with researchers and community, and I think that the reason we really implemented this symposium is to underline on that. Actually, this symposium that we are going to conduct, we will have several sections. I will come back to let you know, but I'm going to, first of all, give the floor to Bruno Spier, who is going to also, on behalf of researchers of the community, to make a small introduction. Thanks a lot, and thanks, Bruno.
Good afternoon. I'm Bruno Spier, a public researcher living with HIV and an activist member of AID, the main HIV community-based organization in France. I'm going to talk to you about the emergence of HIV community participatory research in France. In the 80s and 90s, it was quite simple for activists to influence policymakers with little to no scientific evidence. At that time, the context was very emotional. The media was interested by HIV because we were dying, and therefore, just shouting in front of the Ministry of Health was mostly sufficient to obtain new policies. For instance, non-occupational post-exposure prophylaxis was obtained in 1998 without any scientific evidence. This context changed when HIV became a chronic disease. Policymakers became more demanding in terms of scientific evidence to move forward. Naturally, the alliance between researchers and activists appeared as a promising solution for obtaining solid scientific evidence, which could then be used to convince policymakers to enact change. In this context, with the political and financial support of ANRS, ED was involved in community-based participatory research projects. Such research programs were inspired by the needs of seroconcerned people. It's a bottom-up approach, but also a participatory process in which lay people can play a role at most steps of the research process, from the conception of the study to the data interpretation through data collection and publications. A balance had to be found between the academic expertise and the lay knowledge led by life experience. However, such research needs to follow the same rigorous approach as any science. I'm going to very briefly recall 3 historical examples of ANRS-funded community-based research programs that led to publications and to social transformation. First, on this slide, the lay testing program that was able to show that lay testing was more efficient to attract high-risk MSM who were reluctant to go to medical testing. This program was co-constructed by the CBO ED and Yazdan's team and my own team. Thanks to this data, lay testing became possible from 2010. The second example is the community-based injection education program that demonstrated the utility of this new harm reduction tool. This project was co-constructed with ED, Médecins du Monde, and a group of Perrine Roux in my team. The data that were generated were helpful to introduce such programs into French health law in 2015. The third example is the Hypergate trial, which provided evidence of the efficacy on-demand PREM in high-risk MSM. This trial, led by Professor Jean-Michel Molina, was conducted with ED and involved peer researchers who could enroll, coach, and support participants in the trial. Beyond these initial projects, the next speakers, Perrine and Mehdi, will discuss in details the interest of such research for scientists and for the stakeholders and advocates who are in the field every day. Thank you for your attention.
Thanks a lot, Bruno. So just now, we're going to start the symposium. So our goal was first to start, as Bruno said, by a first presentation by Perrine Roux, who is a researcher at CESTIM Lab in Marseille, who will provide evidence based on different programs funded by ANRS from an academic point of view, academic researchers, and then an example of a community researchers on the participant-based research by Mehdi Karkouri from the American Association de Lutte contre le Sida and from Coalition Plus. So first I invite Perrine Roux, the benefits of community-based research from a research perspective. Thanks, Perrine.
Thank you, Yazdan. So first of all, I would like to thank the ANRS, Emerging Infectious Disease, and the conference to give me the opportunity to talk about community-based research. So as Yazdan said, I'm a research scientist working in public health at the CESTIM unit in Marseille, France. And my main topics of interest are community-based participatory research and harm reduction. So today, for simplicity, I will use the term of community-based research, or CBR, instead of community-based participatory research, which is not exactly the same. In this presentation, I will discuss... sorry. So I will discuss the benefits of this type of research, community-based participatory research, for scientists and more generally for science. To begin, what is community-based research? So this term is used in several contexts, and sometimes it leads to different ways of conducting research. However, there are many references and examples where it is clearly defined. For example, the book published by the INRS in 2012 explains the CBR's main principles, which are based on doing with people and not for people. It is a mobilization of concerned groups at all steps of the research process by creating an alliance with academic researchers. It is also a bottom-up approach from the emergence of the research question to the findings and their dissemination. It is also using and recognizing lay knowledge and living with expertise which complement the academic knowledge. And finally, it conducts to social transformation where the results are useful for advocacy. Another interesting book by Blumenthal et al. Provided some examples about the different community involvement in community-based research. Community-based organizations and groups can help the researcher to recruit participants, but they can do much more than that. They also can have a direct role in the design and the implementation of the research study. They also can be considered as peer researchers. And to fulfill this condition, I decided in my recent research projects to have a peer steering committee composed only with people from communities. And finally, they also can help spread the word about the study and promote its funding. I would like to give you some examples. Bruno gave some of these examples that clearly illustrate these principles at different levels. I will also give you the name of the researcher involved in these studies because they are almost all present at the conference, and then you can ask them some details if needed. So the two first studies, ANRS DRAG and COMTEST studies, with Bruno Speer, was designed in collaboration with the French organization AID to evaluate a community-based HIV testing for MSM with a view to increasing access to testing and care. The well-known IPERGE clinical trial with Professor Molina and Daniela Rojas Castro demonstrated the efficacy of on-demand PrEP to prevent HIV acquisition among MSM. The INRS IRLI study with Patrizia Carrieri and myself showed the effectiveness of an educational intervention for people who inject drugs to decrease HIV and hepatitis C risk practices and abscesses in France. And finally, the DRIVE study with Nicolas Nago and Hoan in Vietnam evaluated the effectiveness of a peer-based intervention to reduce HIV transmission among people who inject drugs. Another interesting study is the Metamorphose study with Jorge Flores Aranda in Montreal on the use of methamphetamine in MSM who practice chemsex. This study focused not only on complications related to chemsex, but also on the aspect of pleasure. The Princess Project with Joseph Larmarange, which aimed at evaluating an HIV community-based intervention for female sex workers in Ivory Coast, placed great importance on helping women to understand their needs and adapt care services to the individual. Finally, the Makazi Project with Annabelle Degré-Dulou is an intervention study to empower migrants regarding their sexual health in France. Let's have a look on the main benefits of this approach, the community-based research for scientists and more generally for science. To answer this question, I talked with each researcher of this research project, and not surprisingly, we have a common vision of their benefits. All the projects I presented in the previous, so now, first of all, the main benefit, the first benefit of doing community-based research is to increase access to hard-to-reach or marginalized population. All the projects I presented in the previous slides focused on this population. MSM with high-risk practices, who practice chemsex or who are highly criminalized in some countries. Women who practice sex work in countries where it is also criminalized. Migrants with complicating living conditions, illegal situation, and difficulties of accessing prevention and care. And finally, people who use drugs, and more particularly those who inject drugs, a population which is highly criminalized in many, many countries. This population shares the same condition of illegality and stigmatization because of their unconventional behaviors. Another important benefit for us scientists is to have a more relevant research question. More specifically, we scientists and communities produce, yes, this question very important for the communities. For example, in an academic context where the research question would be, why do MSM not use condoms or not go for HIV testing? Community involvement encourages scientists to ask more detailed questions, such as, is there another way to protect oneself from HIV transmission? Or how do we adapt HIV testing to make it more attractive to MSM? Regarding people who use drugs, instead of simply asking why they do not stop using or how we could encourage abstinence, community-based associations encourage us to explore practical intervention that could be proposed to reduce related harms. Finally, in the African setting or in the context of migrants in France, we do not simply ask why migrants or female sex workers do not go to health services. Instead, we ask how we could empower them to improve their capacity to deal with structural barriers. Community-based research also imposes us to adapt methodology to field-related constraints. Having people from communities as peer researchers in a study can be an added value in qualitative methods. For example, the photo voice method gives peer researchers the possibility to take pictures in order we can better understand their environment. Their insider role can also be very important in ethnographic studies. Finally, peer researchers can help also in ensuring that items and questionnaires we used are relevant in our quantitative surveys. Doing CBR also requires the use of innovative and adapted methods to reach target population. This is the case in the DRIVE project. It was based on respondent-driven sampling, which consists in a more sophisticated snowballing recruitment where the participants play a key role. Sometimes it is possible to use gold standard methods, such as in the Hypergate trial case, but sometimes it's not possible, and we need to think outside the box to adapt our methods. One example is the AERLI project, where we used a specific method to limit the selection bias due to non-randomization. Community-based research provides also an interesting benefit when we have to popularize or disseminate our findings. More specifically, we scientists need to adapt and change our language during the research process in order for it to be understood by communities. And this in turn helps us to popularize our research to other publics. Then, community-based research provides a unique opportunity to share research practices It gives us also the opportunity to translate scientific results for advocacy and to participate in creating impactful messages for public health decision makers based on our results. From a more individual perspective, and that is why I love the research I'm conducting, doing CBR is a way of sharing knowledge, which would not otherwise be possible, and also to meet engaged people by conducting research together at all steps of a project. It also improves communication, as we need to adjust our language, as I mentioned previously. CBR involves different temporalities. The rhythm of the work performed is sometimes slower due to adaptation to community needs. And this is necessary and useful to ensure excellent research. In contrast, sometimes we also need to act swiftly, especially during health crises such as COVID-19 and more recently, monkeypox epidemics. Finally, doing community-based research leads to humility. Implementing it is also acknowledging that we scientists have not all the skills or a greater level of knowledge. Lay knowledge is equally as important as theory and concept. And as we all know, alone we go fast, and together we go far. To conclude, it is important to remember that the fight against HIV has taught us how to improve the way of doing research. HIV communities and organizations have been essential to this improvement. As scientists, we will apply this new approach to other important public health and societal challenges. Research is characterized by many standards of quality to ensure good science, but community-based research teaches us that research is also about equity, ethics, and humanity. And finally, CBR is an important lever to bring about social changes from evidence-based findings. I would like to thank all the community involved in our project for continuing to share their time, their knowledge, and their services with us researchers. Thank you.
Merci beaucoup, Perrine. Thanks a lot, Perrine. I just wanted to remind people who arrived later, because many people arrived, that there are headphones. Vous avez des headphones. We need the headphones for those who speak English, but also those who speak French, because there will be some presentation in French. Thanks a lot. Thanks again, Perrine. Excellent presentation. And now we're going to move actually to a second presentation. ANRS, and now ANRS, Maladies Infectieuses Émergentes, want to push the community to do research, but as researchers. It's also international. It's huge activities in Africa in particular. So we thought that it's important to have a talk on community policy and action-oriented perspectives. And it will be given by Mehdi Karkouri from the, as I said, Moroccan Association de Lutte contre le Sida. Thanks a lot, Mehdi. And you have a lot of, actually, people in the front line who are actually behind you. Thanks a lot, Mehdi.
Thank you very much, Yazdan. First of all, I would like to remind us that many of my colleagues from Coalition Plus couldn't make it here today because of visa issues, and it's really a shame, especially people from Africa, Southeast Asia, and Latin America, and it's really a shame. This is not my presentation. So thank you, ANRS, for inviting me here today. And following on what Perrine just said, we saw that community-based research has stemmed from many reasons. unmet needs of specific communities, ever-emerging issues about HIV, in HIV prevention and care, the need of innovation, but also this growing acknowledgement of what we call the experiential knowledge, the knowledge gained through living the difficulties and through experimenting the difficulties. All those conditions has led the researchers, the scientists, and the community people come together and make research together. But first of all, who is the community? Who are we calling the community? Actually, community is not a thing by itself. It's more a result of a social construction. It's a group of people that share common characteristics that give them a sense of identity. This basically, it could be anything. It could be geography, people living in the same neighborhood, could be identity, queer, LGBT, nation, citizenship, could be shared values, could be some common norms. So basically, it could be anything. It gives a sense of identity, and usually people from the same community, they have a tendency to structure themselves as a community-based organization. That's the most common form it is taken to exist legally. I'm not going to go through this slide because Perrine has wonderfully described how harmoniously the tasks and the duties are split between both sides. And I'm going to try to answer the question, why are we involving community in research? What is their added value? Well, first of all, community, people has a better knowledge of the community studied and their specific needs. That's very important. We have this wonderful research project in several countries in Africa because we wanted to understand why women are not undertaking PrEP as much as men. And of course, it's called PrEP Femme. And of course, we had to go and work with the community involved, women. People from the community will talk more freely to their peers instead of talking about some very intimate subjects like sexuality, for instance, instead of speaking to complete strangers, scientists. So of course, this is leading to a more accurate and more comprehensive information about the field. They have a great capacity of mobilization of themselves. Perrine mentioned the RDS methodology that we can use, for instance, in the biobehavioral studies. And those studies rely completely on networks. And if you don't have the network, you don't have the research. And of course, we can also use, there are some resources, actually a lot of resources that exist already in the community, and we can put them at good use for the sake of research. Now, from the other side, why do communities would engage in research? What is bringing to the community? Well, first of all, the academic and the public validation. Research will lead to publication, to communications, like a conference today. And this, in turn, will offer a better exposure and a better recognition of their efforts. And this will lead eventually to the fact that the community is taken more seriously by policymakers and donors. And this is very, very important. And more of that, it will help the community to validate the relevance of the subject of research, of the question of the research that they have chosen, and that it is supporting their advocacy towards media and policymakers to make them understand that this issue is relevant and it is important to be addressed. Of course, communities also would engage in research because they know that this will generate a huge amount of data that will help them to achieve social transformation, which is the ultimate goal of community-based organization, isn't it? So the community research will help generate new knowledge about the community, to understand their habits, their needs, their practices. I can give the example, for instance, of the ANRS, the study ANRS, Hypergay and Prévenir, that we understood that an oral daily PrEP pill may be not adapted to everyone, because people can have some periods of their life where they have less sex than others, and they felt that taking a daily pill wouldn't be as relevant as if they could have a daily PrEP, and this research validated the fact that daily PrEP is feasible. Community research leads to change in individual behavior, in societal practices, even in policies. In Morocco, HIV testing was, by law, exclusively restricted to physicians, to MDs, not even nurses, not even to any healthcare professional. And ILCS did research with the help of scientists about an offer of the feasibility of community lay providers HIV testing, people not having any medical background, and it was a huge success. And this helped us in and supported our advocacy towards the regulations authority to change the law, and we have achieved that. It took us some years, but we did it, and today we have this community lay providers offering HIV testing everywhere in Morocco. So we can change policies. Of course, we can expand new interventions, reach new populations, and of course, we build trust. The community builds trust towards the research results, which help them buy into the findings of the research. Capacity building and quality improvement, of course. Community people engage in research will gain new skills, will gain expertise that they can carry over into other areas of their life, employment opportunities, education, improving their prospects. This is very important, and they understand that the skills they have gained, they can put them at good use for solving a lot of other determinants of their life, not only in health, but in a lot of other areas in their own life, helping them taking control of their own life. And this is what we call activism, actually. This is activism, and this is where it can come from. Community research also helps us raising standards and engage in quality schemes, in quality improvement. Like when you do research, good research, you have to write down everything. You have to have a very stringent protocols. You have to write the standard operating procedures for everything. And Bruno Spiro was mentioning in a conversation earlier how in INRS Comtest, the project studying the feasibility of HIV testing by lay providers, they had to write every SOP of HIV testing and how they engage in quality improvement. And this is crucial. And last but not least, on a more personal stand, the community research is helping in personal development and positive self-improvement of the community people. It will help them grow their self-esteem. We tend to see sometimes that community members, we tend to think that they are more disadvantaged in comparison with scientists, maybe economically, maybe educationally, and in other ways. And doing research, and also because community research is breaking down barriers, class barriers, racial barriers, economical barriers, and everyone is treated the same. Because of that, the community members, they grow their self-esteem, and this is leading towards a very positive social change. So in conclusion, community-based research is a win-win process for both sides, of course. It is a long-term commitment because it takes a hard work, a long work. It is not one shot and it is done. It will, of course, as we have seen, produce the best and most accurate information possible at the time where it is done because of all the reason we mentioned. And ultimately, it is going to empowering the community and then leading to a social change. And social change is the absolutely ultimate goal of community-based organization. And thank you very much.
Merci beaucoup. Thanks a lot, Mehdi, for your presentation. Thanks again, Perrine. So I first wanted to welcome also our French Ambassador for Global Health Excellency, Stéphanie Sédiou, and thanks for coming for the concluding remarks, and we will be there in a few minutes. So I wanted also a look at the time, because Yves Souterrain, it will kill me if we are late, but we are 5 minutes in advance, Yves. So this is the occasion also for me to thank all the ANRS team who works really hard to try to put this symposium, a lot on the boat for the monkeypox, a lot on the crisis of COVID. So thanks a lot again to all the ANRS team also. I think it's important to underline. So now, after this excellent presentation, it's a pleasure for me actually to introduce the two facilitators that are going to help us to actually moderate the panel that we have set up. So I think that Mehdi, Perrine, Bruno and myself were going down and we give the floor to them, but I wanted first maybe to introduce them. It is a pleasure for me to introduce the moderators, Joseph Lamarange from IRD CEPET France. So Joseph is really someone who has helped a lot on pushing research around HIV, but not only HIV. And he has a very important responsibility in the agency. I thank again for the work he's doing, not only for himself, but for the community. And it's also a pleasure for me to actually introduce Kate. So Catherine Hankins, who is a immunologist at the University of McGill in Canada. She's at home. And also with whom I have worked a lot, because she's still the chair of the SAB of EDCTP, so involved in really important things for sub-Saharan Africa. And it is a pleasure to have it here. Thanks a lot, Kate. So we're going down and give you the floor for the following panel. Thank you.
Bienvenue tout le monde. This is so close to my own heart, this whole idea. And I think we've come a long way, moving from talking about interventions and target populations to talking about co-creation, co-design, co-implementation, programs and policies, not doing things to people, but doing things with people. And it makes the science better. And we're going to hear today about 5 different projects that are working on this. And I'm going to start by introducing our first one. And it's Nguyen Quat, who is a medical doctor in Vietnam. She co-founded the Institute for Social Development Studies, ISDS, in 2002, and the Center for Support Community Development Initiatives, SCDI, in 2010. And she's the co-PI of the ANRS DRIVE project aimed at improving access to HIV and hepatitis C treatments for people who use drugs in Phnom Penh. And I think we have a slide up for you, and we'll start by asking you a couple of questions. So first of all, where did the idea for the research come from? Was it who had it first, and how did stakeholders get involved in the design of your study?
Thank you, Kate, and good afternoon, everyone. about the research idea, it's a long story. Actually, it started with a policymaker, with the director of our national HIV program, in a conversation with Francois Barré-Sinoussi, who coordinated the ANRS site in Vietnam at the time. We have a big epidemic among people who inject drugs in Vietnam. You know, up to like 30% of the people who inject drugs was HIV positive. 80% of the people who living with HIV in the country was infected by injection drug. So the director of the National HIV Program asked Francois Barré-Sinoussi to help to identify the intervention that can prevent HIV transmission among people who inject drug. So that is start of the idea. And then ANRS came into the country and discussed with stakeholders, including us, the local NGO, the community of people who inject drugs, and then bring on board a team from the US. So we was discussing, and we came to one of the questions that because for the benefit of the collaboration between the North and the South, we see that in the North, in developed countries, there are some places that HIV transmission among people who inject drugs is almost stopped, like in France, in New York, etc. So the question is that can it happen also in the low resource setting, like in Vietnam, in the lower middle income country? Is it possible? Then that is what we are, the researchers, passionate about. But then when we discussed with the community, they got so excited about that. If we can really stop HIV transmission among the people who inject drugs, what a dream. And then it developed from there. So yeah, we have a big consortium of people who are involved in this. And I think like 70%, 80% of the members of the team come from the community. And it took us 2 years to design the research, but we are very happy about that.
So tell us a little bit about the challenges in implementation in partnership. What are the challenges? Does it cost more? Does it take longer? Are there difficulties understanding each other?
Yeah, it's messy at the beginning. And you can imagine, we are from 3 different countries, France, US, Vietnam. So first is the language. So we finally we have to set up, we came up with the idea of having simultaneous translation. We have a headset for everyone, and we have a simultaneous translation. So that was the solution we came up after like a year. So translation is the one. And then coordination between different teams. We have a lab team, we have a clinical team, we have a community team, we have a social science. So a lot to coordinate. And then there's a challenge for implementation because drug use is illegal in Vietnam. So it's the first concern we are talking about, like how we work with the police, how we deal with the police to make sure that our participants are safe, and also, but to make sure that people are not afraid to come. Yeah, so that's one of the many challenges.
Great, thank you. I'm going to turn over to Joseph now, and I would encourage people to think about what questions you might like to pose to Wan Quat, and also online if you want to pose a question, and then make sure you grab her when you're going out of the room and ask her more questions. Joseph.
Thank you very much. The next panelist will be speaking in French. So for the people in the room who need translation, just to remind you that you have headset at the entrance. And for people online, you have a way to select the appropriate channel.
Et donc c'est avec grand plaisir que nous accueillons Bintou Dembélé Keïta, qui est la directrice.
So we are welcoming the general director of the association ARCAD Plus Health Santé Plus. It was the first community center to have access to prevention and care in Mali as early as 1996. And more recently, ARCAD Santé Plus set up the Ideal Clinics. It's a community-based clinic for the key populations. It's one of the 4 sites of the cohort ANSM ANRS that offers PrEP for male homosexuals. There's been a lot of projects within ARCAD Health Plus. How did you build the partnership between ARCAD and the different researchers? Thank you, Joseph. It's a real pleasure for me to be with you this afternoon to talk to you about this very exciting experience between the research team and the community. The MSM PrEP project is an initiative, a concerted initiative for the beneficiaries of the sexual health clinic, which is a specialized space for MSM. This project was added to a study, a research study that existed beforehand. It was the project called MSM Cohort. It's on this project that we based the project because the community had learned about the PrEP existing in the north, and they had information that it was efficient. So they came to see me, they consulted each other, and there was a very powerful community council that was made up of the moderators, the facilitators that were part of the MSM cohort study. Within this framework, they came to see me, and we organized different meetings with the North community teams, with Christian Laura from the ERP in Montpellier, and we organized focus groups so that everybody could pronounce themselves. And within this situation, very dynamic partnership situation, the research project was set up. Thank you. Maybe you could share with us, beyond research, the different research programs, what was the fallout on the care offer in the clinic you manage? There was 4 major consequences: a broadening of the services to the MSM communities that were seronegative, because before we were only looking at the HIV positive population. So we needed to improve the access to PrEP. So we set up files for the seronegatives MSMs in order to have a risk assessment. And with this risk assessment, we managed to offer the following services: quarterly screening and testing, the collection of all condoms and lubricating gels, and a screening. And we needed to be able to offer the PrEP. And in order to offer the PrEP, we needed to have risk criteria. That was essential. Secondly, there was a strengthening of the capacities in the medical teams, but not only. The community representatives were increased. They all offer PrEP, and they can organize focus groups and speaking groups, and they can bring this PrEP to remote areas, and they can provide advice to people to better use the PrEP. Thirdly, the influence of our policymakers. Thanks to the different information that were produced, with the data, we were able to influence the national therapeutical strategy in our country. They accepted to put PrEP within this national strategy. And fourthly, the funding opportunities that it created, because PrEP was bought for the Malian population, and it was possible thanks to all this. That's what I wanted to say. Thank you very much.
All right, our third speaker will be Jorge Flores Aranda. He's a professor in the School of Social Work at the Université du Québec à Montréal, and he's interested in the links between substance use, sexuality, chemsex, and the social problems experienced by various populations, including sexually and gender diverse individuals and people experiencing homelessness. So Jorge, where did the idea for the research come from, and how were the stakeholders involved in the design?
Thank you. So, bonjour tout le monde, or good afternoon everyone. Very happy to be here with you. Thank you for having me today. So this project came from the community, but also from the academic world. I have to say that before this project, we did another one named Metamorphose, which was also a community-based research project. And Metamorphose, which was Catalyst projects, allowed us to be in collaboration with stakeholders, public health actors, community-based organizations, and also people with lived experience. So then we decided to put in place this project in order to develop some practical guides for institutions who want to offer services for people who use methamphetamine in chemsex context. And maybe for those who want a refresh of what chemsex is, I can briefly see a short definition. It's like it's a form of sexualized substance use, well documented among LGBTQ+ community, and the goal of chemsex is to prolong or intensify sexual encounters. Actually, the literature is document more the experience of MSM who practice chemsex, but we know that chemsex is also a practice among other LGBT communities as trans people, non-binary people. So actually one of the challenges to document this practice among all other layers of the LGBTQ+ abbreviation.
So what was the added value, do you think, of a participatory collaboration? What did it result in that would not have been the case otherwise?
There are a lot of added values. I think, especially in I'm going to speak about more chemsex field. One added value of this practice, of community-based research in this field, is to make voices heard by actors of the public health community, public health actors. For example, with this project, we are in collaboration with the Ministry of Health of Quebec and also with the Public Health Direction. And for us, it's very important that the result of the project will be rapidly translated on actions and on interventions. So the value added is to make voice for people with lived experience be heard by public authorities. And another value added of community-based research in this field, it's also to document more deeply this phenomenon and also to say that this phenomenon is not only a risky one, because of course there is some risk of doing chemsex and there is some harm of doing chemsex, but for a lot of people it's not necessarily always a problem, but some people would like to reduce harms associated to chemsex. So another thing is also to show another face of the chemsex practices. And this can be done with the collaboration of the people with lived experience who participate in the research.
That's an interesting idea, the harm reduction with respect to chemsex. That applies, I think, everywhere. Mm-hmm. Okay, I'll turn over to Joseph. Thank you, Jorge.
Thank you, and please keep your questions. We'll have a global discussion at the end. Notre quatrième panéliste, alors n'est pas physiquement avec nous, mais il est connecté en ce moment. Il s'agit de Selom Agbomadji.
Our fourth panelist is connected. Selim Aboumadji, who was a project manager for the NGO called Espoir Vie Togo, is very committed towards vulnerable populations, especially in Togo. He's got more than 10 years of experience to fight HIV. He's not with us, but his presentation was actually pre-recorded in order to avoid any technical issues.
Je me nomme Selim Aboumadji. J'étais assistant de recherche quantitative sur le programme de recherche cohorte MSM au niveau de l'ONG Espoir Vie Togo. CoMSM, le nom c'est cohorte des hommes ayant des relations sexuelles avec d'autres hommes. Donc c'était un projet de cohorte qu'on avait réalisé dans 4 pays de l'Afrique de l'Ouest, dont le Togo, le Burkina, le Mali et puis la Côte d'Ivoire. Bon, en fait, le projet avait déjà commencé par un projet pilote qu'ils ont développé avec le Mali. Et c'est de là qu'est né le projet. Donc, c'était ensemble avec le Mali qu'ils ont conçu le projet et ils ont cherché les 3 autres pays qui se sont ajoutés pour la mise en œuvre. C'était l'équipe de chercheurs. L'équipe de chercheurs, je crois que c'était l'INSERM qui faisait un truc avec le Mali à l'époque. Puisque c'est vrai que nous, on est dans le volet communautaire, donc il y avait vraiment une symbiose, puisque, bon, à la base, c'est nous qui produisons, bien qui fournissons les données terrain pour avant que les chercheurs ne fassent l'analyse et ne produisent les rapports ou bien les publications autres là. Donc, il y avait quand même une bonne collaboration. Il y avait régulièrement aussi des réunions trimestrielles qui se faisaient pour toutes disciplines confondues. Et aussi, en dehors de ça aussi, avec chaque discipline, c'est-à-dire l'INSERM, par exemple, avec l'équipe de sciences sociales aussi, on faisait aussi nos réunions, que ce soit mensuelles ou bien au besoin aussi, s'il y a peut-être une modification à apporter sur le questionnaire et tout ça là. Et c'était la même chose aussi avec Coalition Plus, avec les pairs éducateurs. Donc, en termes de la recherche, on ne s'est pas senti laissé pour compte. Il y avait tellement cet accompagnement-là, ce qui fait que CoMSM a eu vraiment un succès. Quand on aujourd'hui, l'ONG Espoir Vie Togo, l'ONG Espoir Vie Togo est aujourd'hui un centre de référence en matière de la mise en œuvre du programme ou bien de la PrEP au Togo, puisque depuis février 2022, le Togo a passé à l'échelle l'utilisation de la PrEP. Donc, pour pouvoir, quand on prend même l'élaboration des documents, des politiques en lien avec la PrEP ou le cas de mise en œuvre, c'était nous au niveau de Espoir Vie Togo qui étaient des référents ou bien on était des personnes ressources pour pouvoir contribuer à l'élaboration et à la validation de ces documents-là. Et aujourd'hui aussi, on est très, très sollicité pour pouvoir former les praticiens sur le terrain en ce qui concerne comment faire la mise en œuvre de la PrEP dans les structures et autres là. Avant, personnellement, je ne maîtrisais pas grand-chose en matière de recherche et autres là, mais avec l'expérience de CoMSM et aussi certaines formations pratiques qu'on a reçues, ça a permis peut-être plus de m'orienter vers la recherche. La recherche avec les communautaires, par exemple, bon, moi je dirais que peut-être les communautaires produisent ou bien fournissent les données que le chercheur essaie de matérialiser. Et en retour, le communautaire utilise les données matérialisées par le chercheur pour pouvoir faire un plaidoyer et autres là, pour pouvoir faire changer une situation. Donc, les deux quand même sont liés ou bien sont complémentaires. Les challenges, c'est en fait, vu que c'est une assistance qui se fait à distance, Donc, on est en Afrique ou bien où la connexion aussi n'est pas aussi trop au top. Donc, c'était aussi ça les soucis. Un petit message clé, c'est de dire que c'est un partenariat gagnant-gagnant entre les chercheurs et puis les communautaires. Donc, les deux entités doivent toujours travailler main dans la main pour pouvoir produire des données de qualité et avoir de bons éléments pour faire des plaidoyers aussi. Merci.
Selim is online, so if you have questions for Selim later, he will be able to answer. And Kate, to present the last but not least.
Last but not least, we have Tashuna Albritton from New York. She's an assistant medical professor at City University of New York School of Medicine, and her program of research focuses on community-based HIV and sexually transmitted disease prevention intervention research with Black adolescents. She's currently working on a program for providing PrEP to Black and Latino adolescents in the US. So, Tashuna, what was the role of communities and peer researchers in implementing this study and right the way through data analysis, interpretation, etc.?
First of all, good afternoon to everyone. Thank you for the introduction. I'm glad to see that the audience is filled and there's interest in this topic of community-based participatory research. So to answer your question, in terms of the implementation process, so our community partners, if I can back up for a second, they gave input on the aims for the actual grant that went in. The co-PI and I had ideas of how we would collect the data in forms of qualitative versus quantitative, and there were suggestions around kind of changing that. So we modified that to incorporate the voices of our community partner, but specifically to implementing once the project was funded. So our partners were in a clinic setting. So individuals from the medical providers that included nurses or nurse practitioners who were in the clinic, as well as staff and other ancillary support services within their clinics. They were vital in promoting the project. So when teenagers came into the clinic, they would say, you know, while you're here, take a look at this material. If you're interested, you know, can you move forward? They were instrumental in making sure that spaces were available in the clinic for data collection, so surveys could have been completed within the clinic. So they were vital in making sure that space was available for teens to complete the surveys there. They gave feedback if there were technical issues with laptops or desktops. If there were any issues that the teenagers reported in terms of the software. So they reported back kind of technical issues so that we had to resolve. And part of the team, part of our community partners were solely responsible for data collection, particularly the qualitative piece of that. In terms of data analysis, I will add that in the beginning, our community partners were instrumental in going over the measures that we would include in the surveys that the youth completed. So they knew the scales that were going to be there. So in terms when we got to the point of data analysis, they were clear as to what measures they were interested in looking at statistically. In terms of the qualitative aspects of the study, we collected focus group data, and so they were a part of reading those transcripts, developing codes, helping us code it, and once we analyzed that qualitative data, certainly going through some of that data, really helping us to kind of sift through kind of what does this really mean from the quotes that we got from the data. In terms of disseminating that, our community partners wrote abstracts for scientific conferences. They were also leading publications.
Okay, so you're describing every little way along the way, this rich collaboration that was developed. What about the actual research outcomes? You know, having academic allies and community allies working together, what difference did it make in the end?
Yeah, I would say that that the outcomes, specific to the research outcomes, it was less, I guess, I'll back up, as investigators, as scientists, as researchers, we're always kind of thinking about kind of what questions can we ask that are unique, that can fill the gap. And when the community is involved, when we had community allies, it was more about kind of what needs could we meet for that community. So not that the process was not science driven, but I guess the research outcomes became more meaningful for the community. Because as a scientist, I certainly, and my partner, we certainly had our own perspective or ideas of kind of what we wanted to look at. But if we're working with our community partners, the outcomes were certainly going to be what was going to be most meaningful for them.
Great, thank you. What a panel. Congratulations to the whole panel. Stay where you are. We'll open up for questions now. I think our time is really good. We probably have about 15 minutes anyway for questions.
Exactly. And you can ask questions both in French and in English. Vous pouvez poser vos questions en français et en anglais, y compris aux deux premiers présentateurs. Donc n'hésitez pas. And you can ask questions online. We have a tablet, and I guess we can see.
I can't see anything on it, but.
Not yet.
I don't know how to turn it on.
Et dans la salle, y a-t-il des questions, des commentaires? Yeah. So please speak to the microphone, and to everyone, we need to speak always in the microphone for the translators, but also for people who are not here.
Hi, everybody. Great presentation. I am Julia Lechuga. I'm located at the US-Mexico border and do CBPR research. And I have two questions. The first one is, what, in your experiences, how do you deal with the issues of power? Because they always emerge, right? And we want community to be able to feel comfortable and really participate. And so what are your experiences and strategies that you've used to kind of equate the playing field? The second one is, I wish CBPR research would start with the overall goal, which should be advocacy, right? And doing something to really deal with the structural issues that bring inequalities. And so my question there is, in your opinion, how do you facilitate that so that really the community ends up with something sustainable and actionable? So thank you.
Thank you. Who wants to answer first?
Very interesting questions, thank you. About structural issues, I just wanted to mention, for example, that one of the issues I face it in the project, I talk about it, is one structural one. I used to work with peer researchers, and I've been involved in community-based research for a lot of years. And all the time I go through community-based organizations to pay, to remunerate peer researchers. And this time I wanted to hire peer researchers at a university. And one of the major issues was that the university don't have any job description who matches avec the life experience, and they have some exigence in terms of training, work experience, etc. And I work very hard with human resources at the university, and I didn't have a success for this. And actually, I'm working with the unions of the university in order to have some job description that could be applied for peer research. But it reflects that the university still having structural barriers for peer researchers. So if peer researcher doesn't have a university diploma or other work experience related to the university, they cannot be hired. So it's very important that we continue to work in community-based research to demonstrate that also lived experience is as valuable as other work experience. So thank you for raising this issue.
Bintou, et ensuite.
En fait, il n'y a pas de barrière. There is no structural barrier. In reality, it's a team that wins together. And in an ideal world, imagine if we had specific needs and specific issues, and if we had to solve them together. Well, the users and the sexual health clinic for men who have sex with other men, well, they do have specific problems. We are the caregivers and the healthcare professionals in the clinics, and we realize that these problems do exist, and there's nothing we can do. The only thing we can do is to bring feedback and report all this to the scientific team that has the solution, and they know how to solve the problem. And this is the whole team. This is what the team is all about. I mean, they help us. They know how to write protocols, scientific protocols, and we do hold the key to enter the communities. You can ask any researcher to go to a dodgy area and ask questions to men who have sex with other men. No, they won't be welcome. They won't be able to do it. So we know how to do it. Hence the benefits of this teamwork between the recipient, the beneficiaries, the researchers, and the doctors in the communities.
C'est basé sur ça. Et c'est tout l'intérêt pour nous d'avoir des occasions comme ça pour nous exprimer, mais pas que. Ce savoir scientifique-là est désormais partagé.
Currently shared, we can share all this, we can share the knowledge today. We know it's not only about releasing publications in science. The main point is to solve the issue, and then everybody's happy. This is why I'm saying today that thanks to community-based research, there's been some sort of mainstreaming, of democratization of scientific knowledge. And I'd like to thank you for this, all my research partners. Michel Ezechkin, thank you. I can speak. Yeah, I can speak French. Yeah, you can speak French. Yeah, go ahead. My question is for Bruno Spier. The patients and the community organizations, they work together for the design and evaluation of the clinical research protocols in the ANRS. And it's been like this for more than 25 years. But still, this community-based research that we've been talking about, well, this is quite a recent phenomenon. And I have questions. What do you think? I'd like to have your feedback, and I've had outstanding presentations. So why is this emergence so recent? Why did it emerge so late? What has changed in the world of researchers? Can you tell me? We know you can answer, or your peer will answer. What has changed in society that led to this emergence? What has changed within the communities so that this partnership, which is so productive, well, it only emerged now? It's so recent, and why? Why is this? I will answer in French. Yes, of course, I can answer in French. Yeah, yeah, because we have interpreters. Well, it takes a lot of time to get to know each other between the community and scientific world. It's not that simple. I see many colleagues for other pathologies that love to be involved in participatory research, but they've never come closer to civil society. And we started first to get to know each other back in the 80s, just to argue with one another. It started with major fallouts. It was really, really tense. And then gradually we got closer together when Michel became the manager of ANRS, with a strong connection with the patients' representatives, ANRS, and also the involvement in the clinical trials assessments. So at the time, we were going through a sort of intermediate phase. We were no longer having fallouts. We were, sort of observing the researchers. Of course, we had our say, but we were observing the researchers, but we couldn't act directly in the protocols. But then came the next phase, and we thought, in some areas, why not? Especially in prevention. I think that
dans des protocoles de recherche, mais ça a pris du temps. Et tout ce temps, c'est de l'acculturation réciproque entre le monde académique et le monde communautaire, où on s'invite les uns les autres, on commence à savoir comment l'autre raisonne, et c'est seulement tout ça qui permet de faire une bonne recherche collaborative et participative.
Si je peux, oui, juste faire un petit commentaire, c'est dans le VIH, il y a des communautés qui savent faire de la recherche aujourd'hui. Pour travailler dans d'autres domaines, on est parfois face à
Sometimes we have to deal with communities who do not want to be bothered with scientific constraints. So this is a two-way.
To this is these structural impediments that funders would not fund this kind of research, would not realize that it took more time and more resources and that it was slower in producing results, but the results would be better. So it's not just the scientists and the community, it's also the funders.
And to acknowledge that implementation research is research.
La recherche d'implémentation, c'est de la recherche. La recherche.
Point à la réponse
I'd
de
like
Bruno.
to add one point to what Bruno said. What came to my mind when Michel asked the question, the first thing that came to my mind is that obviously today there have been some recent changes and therefore we've been able to work better together. But first of all, I think it's due to the emergence of new technologies, the widespread of knowledge. We have less specialized jobs and we do communicate better. In the past, there used to be a separation between social science, clinical research, and now we share a lot of things together. And this is what we've been doing in our team, and this has been very helpful to help us work together and understand better everything that's at stake for science and the community. Thank you very much.
Bonjour, Flavien.
Good afternoon, Flavien. I'm very happy to see the work of my French colleagues. I'll ask my question in English because Perrine's presentation was in English.
The same question that was just asked before. We've heard a lot about community participation in research, and I'd just be interested in the panelists' views on research participation in community. So the idea of research led by community where researchers are only playing a support role, but the research is actually conducted by community. And just clearly there are funder challenges with that as well. But yeah, just any thoughts around some of the pros and cons of that?
And last question, maybe?
Bonjour, Flavien, ravi de voir le travail des collègues français. Je vais poser ma question en anglais vu que la présentation de Perrine est en anglais aussi. It's related to first a comment, so just a reminder, we really shouldn't be using the term hard to reach. Populations are not hard to reach, it's just that the systems that are in place are not made for those communities to be able to access services. And the second thing is that I was surprised that in the slide that Perrine presented related to the marginalized populations, ethnic minorities were not included. And then I remembered that in France, ethnicity is one of those data points that's not collected. And so I wanted to ask questions related to how do you think that affects your work, first, and then second, how do you, more importantly, how do you know which community to involve in your research when there is clear big data points missing, which we know are quite important in other countries like Global North?
Okay,
Thank you, Perrine, and then Tashuna maybe for the first question.
Okay, so if I well understood, yeah, I didn't talk about sexual minorities and other minorities. but it is in our research team some very recent research that we are conducting. So I just presented some research that have been already finished, published, and but this is our current worries, trying to connect with these communities, and we have today in our team some people from these communities. So I hope in a next presentation I will share with you some results regarding these communities.
In relation to the initial question, that's an excellent question. And I can only speak for what I do. When I'm involved with community, I actually ask them kind of how can I support them? And in some cases, community-based organizations or leaders are interested in kind of facilitating their own research, and a lot of it is specific to kind of how do we evaluate what we're doing. And so I will do like a webinar for the organization on certain skill sets, research kind of analysis, whatever they're interested in doing to help them build that capacity. And if they have additional aspirations to extend a stronger research component to what they do, I offer that as well. There's no money exchanged. It's, for me, community building, trust building, relationship building. How can I help you? And that's the extra time, I think for some of us as researchers that we invest. And so I think that's a way that we can support, is just by offering our services when the organization says that this is what they're interested in doing. And hopefully it will prepare them to take a more leading role in building research capacity and leading their own projects internally.
Thank you, Tashmuna. And Oran, if you want to add quickly.
Thank you. I think we probably need like 2 or 3 days to discuss this, if not more, right? A lot of things to share and to discuss. But I think in terms of having community-based research to really work, we need to build community structure, and we need to build community capacity. So reason why some of us can do like ACE in France or Coalition Plus can participate, can be such a big part in the research in France, because you have a community structure. You have already built the network, built the organization. So that's why you can participate, you can do the research. So I think for many of us here, we benefit from the investment of the Global Fund to the community system. So because of that system, that the researcher can plug in that system and work together. Imagine there's nobody, there's no structure, and you go somewhere and do research among people who inject drug or MSM. It would be really, really hard to even recruit participants, let alone the meaningful participation involvement. And also, in order to do research, a real community-based research, we also need to invest in the capacity, research capacity for the community. So that means spending time. It's not only, I think it's good that we support them, but it's more like work together. So we build the mutual understanding and you build capacity so that we can work together as partners in the long term. So thank you.
What a panel, what a panel. We're going to stay put and turn over to Yazdan, who's going to introduce.
Yeah, thanks a lot. Thanks for this very, very interesting, and thanks also for everyone, because we were very numerous people in the room. So thanks a lot. I just want to say also that the discussion regarding the fact that HIV community has been involved since 25 years, knows what. Now it's important also also that this community help us to engage the other communities. We are doing this for long COVID with transplant associations for 2 years now. Your help is very important. Now, thanks again. And you know, there was a session just before by International AIDS Society's journal on implementation. So there were, at that session, people from Gates, NIH, PEPFAR, ANRS on a panel, and everyone, of course, underlined the important role of communities, but also the decision maker. So we thought that it is important that this session be ended by a decision maker, and it is really a privilege for us and an honor to have Stéphanie Sédou, who is the French ambassador for Global Health, to end, although she is a close decision maker to us, and I wanted to personally really thank her because she has always involved research in the agenda on HIV action. So thanks a lot, Stéphanie, and thanks for final conclusions of this symposium. Thank you.
Thank you so much, Yazdan, Professor Yazdan Pana. Je vais parler en français, but only after a few words in English anyway, so you have time to put on your earphones. This was such an amazing event, and I would have liked to have 2 or 3 days, like Juan said, to hear even more of your amazing achievements. And indeed, science is absolutely key in ending this pandemic, but science, and I think you've shown it, has to have a purpose, and a purpose grounded in the people, which is what indeed, and not in any way, as was said also, in a way that is structured and that brings benefit to those participating. So very powerful examples and an amazing session. Thank you. I have a few notes which I will now turn to in a more official way into French. Et donc, vous dire, ça a été...
I'd like to say that, as you said, thank you for calling me a decision maker. So you made a very relevant comment when you said that there's everything that has to do with scientific accountability, responsibility, and communities' responsibilities. And there's also the responsibility of those who set the terms, the funders. And I think we can afford to say that France has succeeded in this by supporting ANRS right from the start, by supporting ANRS approach, and by providing support for the reinforcement to ANRS agency, which has become ANRS MIE, with hopefully a consolidated budget that's been recently increased, and we provide clear support to this approach. And I'd like to say that this approach has been followed by other French research institutes and also in the world, but I'd like to speak on behalf of France. I'm talking about ERD and other organizations, and these approaches are about implementation science and what go through a community-based science. And I was very happy to hear that during John Kingerson's presentation yesterday, he said science of implementation is one of the new orientations of PEPFAR, and what you presented today is fully included in this movement. So it's very important that you did it, and it's the scientific evidence of the efficacy of community-based work and the scientific evidence of the benefits of the involvement of communities for research, but also for various practices. And I was absolutely fascinated to hear that as scientists, you've been questioned in the way you questions you ask yourself is it the right question to achieve the scientific results I've been trying to have? or is it the best approach for the community I've been working with?
So it's about what science can provide, and that's quite remarkable. France has been supporting this approach in a very determined manner. This in the press. It is an approach that was initiated in France in 2015 with a strong support regarding community-based research, and Marisol Touraine, who was the Minister of Health at the time, did a lot for the WHO to change its policy, and that contributed a lot to the that the support of the French authorities, including some financial support. Well, this support will continue in a very determined manner. We can capitalize on the progress that have been achieved, that you all illustrated with this panel today. As Yasmin said, this methodology and this 15 years of experience, it was quite a long process, but the benefits are obvious today. Well, we hope that it will be benefiting other scientific approach. We are quite challenged by the monkeypox epidemic, and we know that communities throughout the world have taken actions and will be able to test these methods in that way. We have all the ingredients to do so, and we'll continue with this approach, this partnership, multiplayer approach. I would like to thank the ANRS to have organized this event of really high quality. France will be supporting you. Before I wish you well for the future, I would like to remind you that we are expecting you at 6:15 in the Montreal French Union for the evening of the French partners regarding the contribution of the World Fund regarding the resilience of a health system in a context of crisis. And with this, I would like to wish you well for the rest of the year 2022. Thank you very much.